Talk to me. WSRadio.com.
Welcome to Performance in Motion with your host, Dr. Dennis.
Okay, folks, we are back with a very special guest, Dr. Brenton Wynn. How are you, sir?
I'm doing well, very well.
We are having a tremendous time here, and I'm sure you folks, if you had a pen and paper out, you would get a tremendous amount of information. Okay, Dr. Wynn is going to finish up with this new technique for a few minutes, and he's going to share a personal testimonial about a few other things. So let's listen to Dr. Wynn.
All right. So what I was saying is that in this day and age where we have this opioid crisis, there's a lot of patients that, or a lot of clinicians are trying to look for ways to continue to manage pain, but to write less opioids. And this is one of the therapies that allows us to do that. With the electrical signaling treatment and all of the physiological responses that it creates, it's reducing pain. It's tissue healing, reducing pain, and so those patients are allowed to titrate down, come off of some of their opioid medications, and hopefully come off of them completely if we get a complete response. So we feel we're doing a responsible thing for the community.
Absolutely, and that protocol is drastically different than the norm that's out there.
Absolutely, and it kind of it parallels with physical medicine, you know, and as your background as a DPT, doctor of physical therapy, you've had a chance and opportunity to utilize multiple different modalities, you know, whether it's vibrational, mechanical vibration therapies, whether it's acoustic like ultrasound, whether it's a transcutaneous electrical nerve stimulator, TENS unit. All of these things you've had a chance, light, laser, heat, and cold therapies, you've had a chance to use. And this is just one more. It's just that with the mid-level frequencies, there's deeper penetration. And and actually, interestingly enough, if anyone's familiar with Fibonacci and of course everybody is, right? No, not.
What was that? I didn't get that.
But basically, 528 hertz is identified as being the frequency of DNA repair.
Okay.
And the device can resonate at that frequency, so we're getting DNA repair as part of this tissue healing. But, you know, John Lennon found that out with playing his music at 520 hertz, and it's also called the love frequency.
So he knew precisely that exact number.
Exactly.
I have a bridge to sell you in New Jersey that is on sale right now.
But in that sense, it falls right in line with what I do, with what you do, you know, as a corrective movement analysis specialist. You yourself see patients that have chronic pain issues, that you're able to utilize your specific methodologies to present outcomes that are just not parallel that I see with other therapy, you know, physical therapy, occupational therapy specialists out there, athletic trainers, and even physicians. So,
thank you.
No, it has been. You've been influential in me to go back and look at those things that I learned as a medical student and as a resident, that for one reason or another, because we get so specialized, that we tend to, you know, move away from. And unfortunately, in this day and age, insurance companies tend to dictate a lot of how we can do stuff because they're basically deciding what gets paid for. And so, you know, if I can do all the things I wanted to do, I probably wouldn't make enough money to pay my staff.
I understand. You know, one of the great opportunities that you have shared with me was to be able to help your sister a few years ago. She had some neck issues while simultaneously you had an employee that had, I think he's the one that fell off the skateboard. So he had an unstable knee. And then recently, you being a martial artist, you had a thumb issue, and we'll leave it at that because we don't want to get into too many technical details here. We want to keep people focused.
Well, that being said, we're just speaking about the different therapies that are available, and you yourself can provide a unique way of treating patients. Being a specialist in kinesiotherapy, training under Dr. Kase, you've educated me on the correct approaches of taping, the assessment, the reassessment, the taping, the reassessment, and the assessment, reassessment, and just making sure that you're actually getting the results that you want. And if you're not, you have the knowledge to shift gears, change what you're doing, and continue to identify progress in that patient. And that was my experience with you when I had a couple of musculoskeletal injuries, and I said, "Hey, Dennis, take a look at this. What do you think?" And as a physician, we're so specialized, we don't always know everything. And I for one, am not going to start trying to treat eye problems, and especially in myself, I go to my ophthalmologist. So when I have musculoskeletal problems that are nagging or even just a new onset, I say, "Hey, Dr. Dennis, take a look at this. Let's make sure we're doing this right."
That is extremely humbling to have an expert with your background coming to me to get what you need in relation to healing, and specifically when we were talking about cellular healing. Wow, can't even speak today. Come on, wake up, dude. And, the great thing is that, like you said, unfortunately, insurance dictates what part of the body we're going to treat. And, having a martial arts background also, from a long time ago, I've always believed in a comprehensive approach, and I look at someone head to toe.
Right, absolutely.
And so in all these cases, if someone has 3 or 4 ailments or condition or involvement, I can treat all simultaneously. And the great thing is that people tend to gain weight when they're hurt. Isn't that true?
It's true.
So in the system that actually you've helped me develop, people are losing weight as they're healing, and then they're moving functionally versus dysfunctionally.
Correct. And it's one of the things that I tell my patients, and I see this a lot. I just about refer almost all of my patients have some opportunity to do some sort of therapy on an outpatient basis. And just like with physicians, not all therapy providers, physical therapists, occupational therapists are created equal.
True.
And, when I find that patient that is just not progressing with physical therapy, I say, you know what, you need to see Dr. Dennis, because he's got the ability to take my patients who have plateaued or who are not responding to a level where they're responding and actually succeeding and healing and developing those functional motor patterns that allow them to prevent returning to that painful condition.
Absolutely, and I appreciate that acknowledgement. And just to reiterate from what you said earlier, and I'm going to just give a plug here. I do 3, 6, 9, and 12-month programs. The reason being is Dr. Wynn has shared with me that it takes time to heal and restructure the proper movement patterns in our brains.
Absolutely. I mean, not only that, with this combined exercise program and nutrition program, anybody can train hard, but without functional assessment to determine dysfunction versus functional movement, you're going to feed back into your dysfunctional patterns, and that's what Dr. Dennis corrects.
Okay, folks, we're at the end of this segment, and this is Dr. Brenton Wynn, WynnOverPain.com, 619-434-4019. God bless and take care. Talk to you soon.
A
podcast or radio show on WS Radio is a great way to create content marketing. Turn prospects into customers into raving fans. Contact Wade at WSRadio.com or call 866-WS-RADIO.
Life is full of misadventures, from car crashes to home fires to getting choked out on the mat. Yes, I said getting choked out because I'm Carlos Kramer, jiu-jitsu competitor, MMA and media personality, and mild-mannered insurance agent. You can follow my adventures on Kick-Ass Radio, and I can protect you from life's misadventures at Kramer Insurance. Home, auto, life, business, and workers' comp. We're at KramerINS.com, and I want you to join my world.
This is Jackie Bertoni from Jackie's Groove. Come join me weekly on my journey through the music business as I take you behind the velvet rope, interviewing industry notables such as Al Di Meola, Michael McDonald, and Al Jarreau, to name but a few. Listen to their stories on being in the studios recording #1 hits and onto the stages throughout the globe. Allow me to be your music historian. You can hear me live every Monday at 2 p.m. and every Wednesday at 12 noon Pacific Standard Time or 24/7 on jackiesgroove.com. Ready to get your groove on?
One person has the power to change the world, impact millions of lives, and leave a legacy for lifetimes to come. That person is you. In the New York Times bestseller, What is Your What? Steve Olsher, award-winning author and founder of the Reinvention Workshop, reveals his proven process that has helped thousands of men and women discover, share, and monetize the one thing they were born to do. Grab your free copy now at www.whatisyourwhat.com/free. That's www.whatisyourwhat.com/free.
Take a break from politics. Tune in and learn something. WS Radio shows are worth your time and are filled with tips and advice. Add us to your lunch routine, and we'll give you a meal for your mind.
Small businesses are the lifeblood of America's economy. Every Thursday, SBA Radio interviews industry professionals and is dedicated to provide small businesses with timely insights and innovations. Visit www.sbaradio.us for details.
Hi, I'm Nicole Heffel, an attorney with the Heffel Law Firm, and I'd like to encourage you to join me in honoring our troops. Part of the Heffel Law Firm's mission is to advocate for those returning veterans in need at no cost to them. You can help us with this by allowing us to serve you with your estate planning needs. I'd like to invite you to contact me at heffellaw.com. That's HEFFEL law.com, or call 619-550-3080.